Hi, it's Dr. Kraus. Welcome to my living room. So today I want to talk about how to tell if you're ovulating, because normally we would have had the fertility clinic tell you exactly when you were ovulating and exactly when to time intercourse or to have an IUI. And so I want to talk about if there's ways that you can do that while you are at home. So the first thing that I want to talk through is your cervical mucus. And basically your discharge is going to change through the entire month. It's going to start out maybe a little bit thinner, slipperier, whiter. And as you get to ovulation, then it's going to turn into what we call egg white cervical mucus. So this is more of a jelly-like consistency, like egg whites would be, raw egg whites. And once you get to kind of peak ovulation, it's going to be able to actually stretch between your fingers. So you might notice it for a couple of days, but that last day is kind of considered its peak, and that is your day of ovulation. If you don't get any cervical mucus, or you've just never noticed it before, start noticing. And second, if you aren't getting it or aren't noticing that egg white cervical mucus, I'll do another video about how to improve it and get it, hopefully. You're not going to have that discharge kind of all day, every day. You might notice it once in the day when you either wipe on the toilet paper, or you might notice it in your underwear. So that discharge is good. That's what we want. We want that really healthy egg white cervical mucus. And that is also going to tell you kind of when to time intercourse, but I'll do a whole separate video on timing intercourse. The next thing I want to talk through is your basal body temperature. So for this, you need a thermometer that's accurate to 1 or 2 decimal places. And you would take your temperature under your tongue every morning when you wake up. Then you're plotting it out on a piece of paper, or there's obviously programs and trackers to do this now. There's an app for that where you would input that number. And you're going to see it's not a massive jump. It's like 0.2 to 0.6 degrees. It's very small, but you are going to see a bit of a rise that indicates ovulation. Part of the problem is that you need that temperature rise for 3 days to confirm that ovulation occurred. But by then it's too late to time intercourse because an egg can only last for about 24 hours. So I like basal body temperature tracking combined with cervical mucus, or I like to kind of use BBT tracking for a couple cycles to kind of get a sense of when you normally ovulate, and then you can use that information to time intercourse. So don't really use it on its own. Don't rely on it on its own. You might get, like some temperature spikes instead of that really nice consistent rise. So it can be a little bit tricky. I definitely recommend you use it with another technique. The next technique is ovulation strips. So these measure a hormone in the urine called luteinizing hormone, or LH, and it's the same thing that the fertility clinic is using. They're just measuring it in your blood when they do the blood draws. And so those strips are going to tell you kind of when there's a bit of a, again, like that LH surge, we call it, the LH rises, and is basically giving the instructions to your body to release the egg. Now, those ovulation strips, they're fairly cheap on Amazon. I mean, you can get them at the drugstore. They're more expensive there for sure, but you can get just a whole pile on Amazon. They're pretty good. I would say they do have, it's not a false positive. Well, it is a false positive. People who have naturally high LH are going to keep getting positive on that test. And anyone with PCOS, you have higher LH to begin with, which, I would say 80% of my patients are PCOS with a higher LH. So it's okay. It's not maybe the best way, but it's a way. And the last way that might be a new one for some of you is called the Proove test. So Proov, Proove. And it's a new one. It is the only test on the market that measures progesterone. So again, you do this after the fact. You don't use it to tell you if you're going to ovulate. You use it to tell you if you did ovulate. It's the only thing other than a blood test that can tell you for sure whether you did ovulate that cycle. So again, it's a urine test and you would use it 7 days after you ovulated or think that you ovulated based on the other techniques. And then it's going to tell you whether your progesterone shows, a good level, which means you ovulated and have a good progesterone level, or whether you ovulated but your progesterone might need help, which I love this because we know that some women need progesterone to support that first trimester of the pregnancy. So it's going to tell you whether you need that extra support, and your naturopaths are well situated to be able to help you with that, as well as your fertility clinic if you're working with one. So those are kind of the 4 main techniques. If you've been on the fertility path for a while, you may have tried, whatever, all of them, but I wanted to talk about it again today to give you something to feel like you're empowered in this, right? In a situation where absolutely nothing is in our control and we don't even have an end in sight. I find it's always helpful to feel like I have control of some aspect of my life. And so, different things to try. If tracking and, doing all of this and information collecting drives you absolutely crazy, don't do it, right? Talk to your naturopath. We might have ideas of how to customize things for you so that you can still feel like you are in control of something during this crazy time. It doesn't have to be ovulation. So I'll do another video talking about how to time intercourse and how to get that good cervical mucus.